Good afternoon, everybody, and greetings from Ministry of Ayush, Government of India. So I think it's important to understand what role does Ayush play in palliative care? Because when patients are afflicted with cancer, we see most of these patients taking recourse to complementary and alternative medicines or Ayush therapies. And why do they do so? We in fact did a very big study in HCG when I was there working in HCG, where we did a survey around about almost 800 patients, and both with the early stage of disease and both with the late stage of disease. And what we saw was interesting. 25% of the patients in the early stage of disease with primary cancers, these who were also receiving the cancer-directed treatment, 25% of them took recourse to CAM, complementary alternative medicines. And out of these 25%, 60% of them did not tell their doctor they are taking it. They were undergoing chemotherapy, they were undergoing radiation, but they chose not to tell the doctor or their oncologist that they are taking these medicines. Okay? So this is the scenario today. But when you go to the stage 4 disease, metastatic disease, almost 90-95% of them take recourse to CAM modalities. They do every kinds of therapies. They go to shamans, they do rituals, they do astrology, whatnot. Okay? Just with the hope that something can cure their cancer. So there's a lot of trust on these areas of Ayush, and there are also some gray areas where people claim for cures, but there are some very, very promising areas where Ayush can really do wonders in cancer care, especially in the area of palliative care. So let us discuss what we have done in HCG as well as what we have been doing today also there in ministry. So when you look at Ayush, when I say the word Ayush, these are the systems which come into being: Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy. These are the streams of medicine or alternate systems of medicine we call it as. Nowadays they don't call it as alternate systems. We use the word integrative medicine because we have some amount of evidence for using these therapies in various settings. And when you use these therapies judiciously, for which we know that there is some sort of evidence and then some sort of research backing to that, these are called as integrative. So we'll go into those integrative aspects of it. Let us look at one of the very important examples where you can see the role of yoga in cancer. I began my journey in 1998 where I started integrating yoga into oncology patients. That time in 1998, yoga was not so much advanced. So the understanding of yoga is you do a headstand posture, you do a topsy-turvy posture, you do some contortion, that is yoga. Okay? And most of the people, when you talk to oncologists, they used to say, how can my patients are not fit to do yoga? That was the idea. Patients are not fit to do yoga. So yoga is not about a physical activity. It's more about a mental activity where you help in managing or controlling your mind. We'll come to that later on. And if you see in all the yoga research today, the maximum impact yoga has made as a therapy is in the area of cancer. Okay? Huge number of clinical trials have been done. And even most of these, because of these robust clinical trials, which I was also part of some of these big trials from NCI and as others, we have got evidence-based guidelines. And they also are part of the National Cancer Care Network, ASCO guidelines and SAO guidelines as well, where they are using yoga for various aspects of managing symptoms. And we'll come to that later on. So these are some of the various cancer institutes in US where you can see that yoga has been done. There's a yoga department, there is an Ayush department, there is a naturopathy, there is Tai Chi, there is Qigong, there is massage therapy, there is chiropractic, there is acupuncture, TCM for cancer patients. Okay? And if you look at all this, lot of research evidence for this, we come across some of the problem areas in oncology for which we don't have any solution in modern medicine. Most of these patients, 90% of the patients complain of fatigue during chemotherapy, right? Or during cancer-directed treatment. Okay, that is one area which we don't have any solution to. And there are some of the medications which are used like ashwagandha, churna can be very, very useful in patients with fatigue. Okay, a lot of studies have been done on this, and I'm just trying to highlight those studies which have been promising in nature, which are not probably confirmatory, but they can be confirmatory if you take it in the right earnest with good RCT trials. So you also have curcumin. There's also people talked about it as a wonder drug, but today a lot of work has been done in this area. People were talking about curcumin as a compound before, but now they are saying that they're reversing back their decision. They're saying curcumin no longer works better. Turmeric itself is much, much better than curcumin. So use the whole turmeric extract as against curcumin. That is much, much better is what people come again and start talking about. So this has also got very good improvement in case of anorexia, loss of appetite, and fatigue. And morphine-induced constipation, there is Misarcus nehanum, is again a preparation is there in Ayurveda which has been given for, it's just like a laxative, and it's been very useful in case of preventing morphine-induced constipation as well. Dry mouth, xerostomia as well. Some of these avalehas and rasayana therapies in Ayurveda are found to be useful. A lot of evidence is there on this. And oral mucositis, some of the HT Madhu Churna we call it as, okay, some of the, even honey, and even putting turmeric gargle, okay, and even Triphala powder or Triphala Churna, even these three things have been found to be very useful in case of oral mucositis. There are some studies on that as well, okay. I won't go into details of this. Chemotherapy-induced nausea, vomiting, right from lemon and ginger to various herbs. A lot of studies are there, and most of these are home remedies, you know. You feel nauseating, use the smell lemon. You feel nauseating, choose a ginger. Okay, simple things which can be just done at home, right? And these are known to be very useful for these patients. And this has been already been researched also and talked about more in the publications as well. Even with respect to blood counts, tulsi is very useful for improving WBC counts. Okay, Carica papaya, the leaf of papaya. You already have a drug called Caripil. I think you must be knowing about it from microlabs. They made it very, very popular. And we did a study also in HCG where we looked at patients with thrombocytopenia. We gave this medication and we saw that it could help in improving platelet counts in these patients. And we also published that particular study. And it can be also as a prophylactic also to prevent the thrombocytopenia from occurring during chemotherapy as well. Okay. So a lot of work with respect to physical well-being, what can be done. Okay. Ashwagandha is one of the drugs which is, can be used for physical well-being. Is a RCT which was done, published in Supportive Care in Cancer. Even with respect to emotional well-being, Jerry Forte, for example. Okay. Malignant wounds, some of these drugs are very useful. Honey-coated bandages can be used as a barrier dressing. It prevents malodor. Okay. And it is very useful for keeping the wound clean. And this is very, very simple thing which can be done. And we also had one more powder called Kara leaf powder from Western Ghats. And this is very useful for bed sores. So there was a study which was done where comparing salzopyrin with Kara leaf powder in SCG itself by Dr. Raghvendra Rao, who was an anesthetist and pain management specialist in SCG during long time back, 6 years back. And it was a study which we did on, pilot study which we did on about 10, 20 patients. And we saw that using this, applying the powder of this particular bark was reducing the itching, the urticaria, the pruritus which was there in the wound area. And it helped in faster healing of these malignant wounds. Okay, compared to salzopyrin and antibiotic cream and other things. So this was a very good thing which could be used along with this, because clinically it's found to be very, very useful as well. And we have seen acupressure nowadays, and this has also been found to be very useful in patients with motion sickness, patients with nausea, and as well as with vomiting during chemotherapy. Okay, and a lot of other studies are there which are showing effects of Ayurveda and different other pharmaceutical agents in different kinds of aspects, chronic myeloid leukemia, acute lymphoblastic leukemia, and so on. I won't go into details. And you also have Cochrane reviews on cancer. And when you look at Cochrane reviews, you can see majority of the Cochrane reviews which are there, or meta-analysis and systematic reviews, are mostly in the field of yoga when it comes to cancer. The 8 such reviews are there, and I'm told that most of these, out of the 8 such reviews, about 4 of them are already confirmatory reviews. It says that this can be used for this kind of condition. So we'll come to those conditions later on. So what are the problem areas in oncology and how can Ayush help? This is where we should be working together, where we can integrate these therapies together. And we have seen that patients' quality of life improves drastically, distress scores come down drastically in this population, and I'll show you the evidence for the same. So one is the oral mucositis, chemotherapy-induced nausea, vomiting, low blood counts, disease management, example, malignant wounds, reducing treatment side effects, difficult symptoms to manage like fatigue, anorexia, constipation, dry mouth, neuropathy, bed sores. Acupuncture for neuropathy is found to be very, very useful. I was in a very big center in US in Phoenix called Banner Health Foundation, and most of these patients who are receiving neurotoxic chemotherapy were given prophylactic acupuncture. Okay, and they also published the data which showed that it can help in preventing foot drop and misdrop in these patients. Okay, so that is a very interesting thing which was happening. So quality of life, physical well-being, emotional well-being, these are very, very important aspects which we probably don't give much attention to because our focus is more on tumor. Your focus is more on cancer and cancer burden and tumor load. You always look at seeing how efficacious your chemotherapy is. We look at the tumor, we don't look at the person behind the tumor. The person who has the tumor. He is as important as the tumor, right? So we need to take care of those things, and that's where Ayush really plays a very, very important role, because there's a sense of humanity there. And if you look at some of the clinical trials in yoga and cancer, so this is how you can see it's increased over the years, and large number of clinical trials are there, and NCI and even National Cancer Institute in US, they are almost funding right now 68 clinical trials in oncology. 68 clinical trials in oncology, and we just received a funding for a trial on BMT patients recently from NCI, so Indo-US and Tanzania study. Okay. So Ayush under CAMP publications, how many articles are there? When you start keying word Ayurveda and cancer or yoga and cancer, so you can see number of clinical trials are very, very less. Okay, the percentage of these are, most of them are reviews, okay, systematic reviews and opinion pieces, and nothing much about RCTs or clinical trials. That's where the problem lies. Unless you start doing good, robust clinical trials, you cannot really bring this into the mainstream medicine. You have trials on cell lines, you have trials on animal models, but they are not enough, because you can show a proof of concept, proof of hypothesis you can show. But unless it's tested in the clinical population through RCTs, properly conducted, well-designed RCTs, you really cannot make a claim. Okay, they may be looking promising, but unless you test it on proper RCT through RCTs and you do a proper robust design, study designs and bring out those results, you really cannot claim cures with respect to different Ayurvedic medications. So this is very, very important. And here if you see the amount of percentage of clinical trials, you see here around 20.61% for yoga. So huge number of clinical trials are there with respect to yoga intervention. And that's a very, very, very good sign, because only through clinical trials can you generate evidence, and that evidence which is generated can really get into guidelines. Okay? And we are also at Ministry of Ayush planning a very big trial now with PGI Chandigarh, AIMS Raipur, AIMS Delhi, AIMS Rishikesh. So all the 4 AIMS basically, and PGI Postgraduate Institute Chandigarh as well, where we are doing a study on BMT patients. Yeah, done. They're going out, don't worry. So we can see a lot of work is there, clinical trials over time. I won't go into details of this. So I will just go to my study where we looked at various aspects, how it can help in surgery, chemotherapy, radiation and supportive care. These are the symptoms where yoga can be very, very useful. Okay, and we have done a study where on fatigue and all, and we can see this is a meta-analysis where our studies have been quoted, where it is shown yoga can be very, very useful in case of anxiety, in managing depression. It can be very useful in reducing distress. We did a study on breast cancer patients, and we showed that it can be very useful in improving mood states and quality of life. All these are publications, and especially in case of fatigue as well, it was useful. We did a study on patients undergoing radiation therapy, breast cancer patients, with 6 weeks of radiation therapy. We did pre and post assessments. We looked at fatigue scales. We showed yoga could reduce fatigue, fatigue severity and interference. We also showed that it can improve quality of life, both functional, social and emotional. And we also looked at mechanisms. We did salivary cortisol rhythms, 6 a.m., 9 a.m. and 9 p.m. cortisol, salivary cortisol. 3 consecutive days before radiation, 3 consecutive days at the end of radiation. Okay, and what we saw was interesting. We saw yoga could help in bringing down the salivary cortisol levels. Okay, the 6 a.m. cortisol levels came down drastically in the yoga group compared to controls, and this got published in a very good journal called Integrative Cancer Therapies. Okay, similarly, we have done studies on long-term psychological survivors, breast cancer survivors who have been doing yoga and other regimens compared to people who never did that. So these are about 10-year follow-up study. We looked at cytokine analysis, and we saw it can reduce mood, fatigue, sleep, and reduce inflammatory cytokines. Okay, this also got presentation in ESMO Congress in Europe, and Dr. Amritanshu also is here, who is the main author of this study. Okay, this is a study which we did on chemotherapy-induced nausea, vomiting. You give antiemetics, you stop gastric motility. There's gastroparesis. It causes more sensation of nausea and anorexia. So to take care of this, we taught a simple yoga model which can be done on the bedside for 20 minutes. And this helped in reducing nausea in these patients. Okay, we compared that particular yoga intervention with a relaxation technique versus nothing. And this is a 3-arm trial, and this got ASCO Merit Award in 2013 as well. Okay, so similarly, you can see yoga meta-analysis. We've done. They quoted our studies there that it can reduce distress in cancer patients. Post-operative outcomes, it can improve post-operative outcomes, improve suture, prevent secondary infections from occurring, reduce the time for stay in the hospital, and better wound healing abilities are there. We also looked at cytokine levels, and we looked at CD4, CD56 counts, NK cell counts, which was on the higher side in yoga group throughout the treatment compared to controls. Okay, and how was this done? We also did a DNA damage assay, pre and post DNA damage, And we saw that the amount of DNA damage in yoga was lesser following radiation compared to controls. And this also got published in a very good journal. So what is here important here is that now yoga evidence is very robust. It has become a practice guideline from SIO recommendations, where I'm also the chair of the Society for Integrative Oncology for Yoga. And we have brought in guidelines where it's gone into ASCO as well for recommendations, and as well as NCCN. So NCCN is already mentioning about using yoga, okay, for nausea, vomiting. They're already mentioning using yoga for cancer-related fatigue, okay. So they're also mentioning using yoga and meditation, relaxation techniques for cancer pain. So a lot of things are already coming into guidelines today, and that is where the way to go. And this is the conclusive evidence you can see for yoga and meditation approaches in oncology care. Okay, so this is where our journey is. This is what is done till now. If you look at the evidence base for yoga, manages anxiety, improves mood and reduces depressive symptoms, reduces fatigue, improves sleep quality in these patients. Okay, and this is evidence for yoga. So these are all these studies which we have done in SCG. We are the first ESMO certified integrative oncology department in 2014 in SCG, and we did a lot of studies with Harvard, with Vanderbilt. And today a lot of studies are going on. So a lot of studies are going on. I think my colleagues are going to tell what studies are going on. And now we are doing global studies, multi-centric studies with large data sets. So this is happening and because we want to generate level 1 evidence. So that is very, very important. And unless all the Ayush therapies start working in that line, in that direction, this is not going to happen. And I hope this is going to be the platform, or setting up a platform for integrating Ayush into cancer care in the country. Yeah, thank you so much.